Now we continue with the rhinosinusitis again. So whenever we talk about the criteria for rhinosinusitis, so there is basically major and minor criteria for rhinosinusitis. Okay, so what are the majors and the minor criteria for rhinosinusitis? The major criteria is all the features of the nose. So what are the function of the nose? Number one is smell. Number two is respiration. Okay, so this is halted. So there's anosmia or hyposmia. Okay, and of course I told you facial tenderness is one of the most important feature for rhinosinusitis, right? So facial tenderness and anosmia, hyposmia. Okay, and other features like nasal congestion, post-nasal drip, and intranasal drip. So if in case these are the features, these are the major nasal criteria. It's the major criteria. Whenever we talk about minor criterias are the ones which is basically a supporting criteria. For example, fever, malaise. Okay, fever, malaise, okay, headache, halitosis, fatigue, dental pain, cough. These all are actually the supporting or minor criteria. So if in case you have two major, one minor criteria, feature of sinusitis. If you have one major and two minor criteria, feature of sinusitis. Okay. So facial pain, facial pressure, nasal obstruction, nasal discharge, post-nasal drip, hyposmia, anosmia, purulence on examination. Fever is taken as both the criteria, as major as well as minor. So how are you going to investigate a case of rhinosinusitis? So it is simple. Okay, so how are you going to investigate a case of rhinosinusitis? So what are you going to do is you are going to actually see the by anterior rhinoscopy examination. So you can just go for an anterior rhinoscopy with the help of certain instruments like Tilly's nasal forceps. Tilly's nasal forceps. You can just thudicum. I think that's thudicum. Okay, not Tilly's. Thudicum. With the help of thudicum, you put your index finger in the thudicum like this, and then just crush it, and then you just insert it into the nose, and then you just open it. That is thudicum. So with the help of thudicum, you look into the anterior nasal area, right? Anterior nasal rhinoscopy you can do. You can go for a posterior rhinoscopy examination. Posterior rhinoscopy examination, you can look into the choana. Okay, before the choana, you can look into the nasopharyngeal area. So there might be congestion. You can go for a nasal endoscopy examination. Severe congestions and severe hypertrophied turbinates can be seen, as well as severe purulent discharges. Okay, mucopurulent and purulent discharges can be seen in the examination. You can simply go for an X-ray, right? X-ray. So X-ray, nose and PNS. X-ray, nose, PNS, and there is certain views like Waters view. So most probably we are going to go from Waters view. So chin is, suppose if this is the phlegm. Okay, suppose this is the phlegm. Suppose this is your phlegm, we just touch the chin towards the phlegm, and then what we do is we go for an open mouth view like this. So why are we going for an open mouth view? Because we want to look into the sphenoid sinus. Okay, we want to look into the sphenoid sinus. That is why we go for open mouth. If you go for a closed mouth view like this, you will not be able to see the sphenoid sinus. Okay, so Waters view, open mouth, X-ray nose, PNS will help you find out all the sinuses. Okay, great. Now, so X-ray, maxillary sinoscopy, DNE, diagnostic nasal endoscopy. Same endoscopy examination can be done, right? So there can be a flexible endoscope, rigid endoscope, right? And USG for maxillary sinus, right? And CT scan, PNS, MRI. PNS is rarely done. Usually CT scan is much more preferred. Okay. Allergic test can be done. Allergic test like reactive allergen sorbent test. Okay, RAST. And there is one more test, PRIST. This is a paper modal test. Okay, and you can also go for certain tests like radioactive solvent test. Okay, right, and you can also go for like certain tests are there for understanding which are the in the flexor aspect of the forearm. You just put your antigens and then you check where there is wheal. Okay, and you can also go for proof punctures, antral washer. This is actually diagnostic procedure, diagnostic as well as investigative. Why? Because when you go for a proof puncture, the secretions that you get in, you can actually go and culture it, and actually it also helps to clear your sinuses. Okay, but this is now obsolete. We rarely do for proof puncture. Okay, antral washer rarely done. And then you can go for a fungal culture, okay? Cheesy, if in case there's a cheesy nasal discharge, fungoid growth, and if we think this is a case of fungal rhinosinusitis, it's a case of mucormycosis. Mucormycosis has been more common after COVID because of the irrational use of steroids. So mucormycosis, in the case of eyes, also mucormycosis, where signs are much more than that of your symptoms, right? And there is the diagnostic nasal endoscopy, pus in the millimeters. See the pus area, pus. You can go for a sinoscopy, maxillary sinoscopy examination can be done. X-ray PNS, Waters view, occipitomental view, occipital-frontal view, okay, and you have your Rees view. The major one you should not forget is Waters view, occipitomental's view, okay. See, compare this and this, okay. Total haziness, which is the most, okay, so totally fluid filled up. Some of the pictures that I would just wanted to show you. See, opacification over here, full filled with pus. Frontal sinus, CT. In the case of frontal sinusitis, in case if it's a chronic frontal sinusitis, you will not be able to this scallop margin also. The scallop margin will also be obliterated. Okay, so here you can see that this one, right? So over here you can see this demarcation. This is known as scalloping, and this scalloping is actually disrupted in the case of chronic sinusitis. CTPNS. So before going for a functional endoscopic sinus surgery, you have to go for a CT, okay? And there are various cut sections are there so that we can see in every cut, right? Now come to the treatment modality. So for medical treatment, you're going to give antibiotics. You're going to give antibiotics, nasal decongestants, antihistaminics, analgesics and anti-inflammatory, mucolytics, anti-allergy, hot fermentation. These are all the features that we